Yes. Just some housekeeping rules. Thank you once again for joining our first webinar of the year. We are so excited. We have some interesting things today. If you are unable to mute, unmute, gallery view, we can just do a general walkthrough right now towards the upper right-hand corner of your screen. Please feel free to change the view. Gallery view will show everybody's lovely face on camera. And then speaker view will allow you to look at the speaker who is talking at the moment and the presentation that might be shared as well. Use as your comfort level allows. We are open to any form. At the bottom, in case you were to ask any questions, you should see a tab, which is on your bottom toolbar, so that you can enter any questions in the chat box if you need us to see, or that you'd like for us to answer at the end. On the bottom as well, you should see your mute, unmute, and other goodies. If you needed anything else, just raise your hand. Those prompts are below, right in the toolbar, and we will help you. That is it for my housekeeping rules. We look forward to showing you guys what we have planned today, and I will let Cheryl take it away.
I'm muted. So welcome everyone. Thanks so much for joining our webinar today. As Cassandra said, if you have any technical questions, please feel free to type it in the chat. Let us know. At this point, Cassandra will mute everyone with the exception of our speaker, and I will go on mute when she starts. And what we would like you to do is just type your name and your organization, or if you're a brain injury patient, survivor, or a caregiver, just so we kind of know who's on the line. We are recording this, so we're hoping that many people access this after the fact. Not everybody can join us right at the time, but we do know from experience that many people access our webinars after they're over. So I would like to introduce our speaker today. We've been working with Jennifer Tozer, and we're delighted to have her here today. She is a human services professional with over 17 years of service in both the private and public sector. Jennifer joined the Division of Developmental Disability Service in 2015, where she now serves as the Manager of Family Engagement to provide information, resources, and guidance and assistance to individuals and families with disabilities. Jennifer's passion to serve the disability community comes from a lifelong fundamental belief that all people have the right to live well as their authentic selves within their community outside of the professional arena. Jennifer is an avid disc golfer, animal lover, and mother of two. And before I turn it over to her, I did neglect to thank our sponsor for this. We actually have Highmark Blue Cross Blue Shield was our sponsor for 2021, and we are moving that over to the first webinar for 2022, and we're hoping to continue that sponsorship. So I did want to thank Blue Cross Blueprints for the Community. They are a donor advised fund of Highmark Blue Cross Blue Shield at the Delaware Community Foundation. And they have contributed over 21 million to the community since their inception in 2007. Blueprints for the Community was established to serve Delawareans with an emphasis on, but not limited to, the needs of the uninsured and underinsured, and to reduce healthcare disparities in minority populations and address social determinants of health. So to learn more, you can click on any of the links that we'll provide. So we just really wanted to thank them for that. So without further ado, Jennifer, I'm going to kick it to you, and so excited to hear. I know all of our attendees today are going to be so excited to hear what you have to say. Thanks for joining us.
Thank you, everybody. Okay. Can everyone see my screen? And is the volume okay? All right, yeah. Perfect. So thank you, Cheryl, for that introduction. I am here to present some information about the Division of Developmental Disability Services. And we're going to start with the mission. This is our why, and it's valuing persons with intellectual and developmental.
Actually, Jennifer, let me interject 1 second. I'm seeing a blank screen. It's saying that you're sharing your screen. Is anybody seeing her presentation? No. So you have shared, but for some reason it's not coming through, right, guys? Yeah. So maybe try again.
Yep.
Technology, don't you love it?
You know, I don't know how we'd survive with or without it. So let's just try again.
There you go. Perfect. Thank you.
All right.
Everybody can see it okay? Good.
Hopefully you're not seeing my notes, but if you do, it's a-okay too. So
Yeah, that's good.
let me go ahead and begin. So again, I'm Jennifer Tozer. I'm with the Division of Developmental Disability Services, and our mission is valuing persons with intellectual and developmental disabilities, honoring abilities, respecting choice, achieving possibilities, and working together to support healthy, safe, and fulfilling lives. Who it is that we are. In short, we support individuals with intellectual and developmental disabilities to live their good lives by offering services that support them to thrive in their home and community. How it is that we do that, and our role to the community is we operate the Medicaid Home and Community-Based Service 1915C Lifespan Waiver, which is a comprehensive waiver program to support individuals through life's transitions. The division operates a Pathways to Employment State Plan Amendment, which is a program designed to support low-income teens and young adults with disabilities in Delaware who want to work. We manage the Authorized Provider Network. These are the organizations that provide the services funded through the Home and Community-Based Waiver and the Pathways to Employment program. And we also operate a 54-bed intermediate care facility in Georgetown called the Stokely Center. That center is for individuals that meet the high medical acuity need when their needs cannot be met in the community. In order to be eligible for DDDS criteria, you do have to be a resident of the state of Delaware, and you have to have an intellectual or developmental disability with significant generalized limitation in both intellectual and adaptive functioning. This does include autism, Prader-Willi, and traumatic brain injury diagnoses that meet that criteria. The full criteria is on our website, and the link is listed here. I apologize, my words are failing me today. And we used standardized assessments in order to determine eligibility. There is no financial requirement in order to meet DDDS eligibility. It is simply medical. And I mentioned that because some of the other programs we're going to talk about later do have financial eligibility pieces to that. How to get connected? We have the Office of Applicant Services is located in Dover in our Woodbrook suite, but really there really isn't a wrong door. You should be able to call any DDDS location or myself directly in order to be able to get connected. We do have the application and instructions on our webpage, along with some tips on what to expect throughout the process and contact information as well. The most important thing I can really convey when talking about applying for services is I don't want individuals and families to feel as if they have to do it alone. We are here to support. So this is just our basic contact information on how to get connected. What to expect if you feel as if you or your individual that you support, your loved one, would benefit and is eligible for services, and you've completed the application. What you can expect throughout that process is in about 7 days, you'll receive a letter from Applicant Services that lets you know, hey, we received your application. And there would be instructions if there's any other additional information required. For example, an incomplete assessment or a piece of information confirming a state residency. They will let you know what else is needed in order to complete that application process. Once the application is complete, it takes about 30 days for eligibility to be determined. If eligibility is determined, you've met the criteria, within shortly after that 30 days, you'll receive a letter notifying you that you've met criteria, and it will list what some of the next steps that you can expect will be, including being contacted by the appropriate case management entity. And we determine this based on the information that you provide through that application process. If you do not meet the eligibility criteria in your letter, there will be instructions on how to appeal, and I encourage individuals and families to please follow that process. So now we're going to talk a little bit about the supports and services, including case management and person-centered planning. All DDDS recipients, regardless of where it is that they live, what services they're accessing, have some form of targeted case management and person-centered planning. And so a person-centered plan, it's what you want to do with your life. What's a good life look to you is how we like to pose that question, but it could be your student's IEP, it could be your vision board, it could be whatever it is that you're thinking you want to achieve with your life. And the targeted case management is defined as frequent engagement to address current and future needs. There's a couple possibilities for case management depending on your situation. Individuals who live at home or in their own home are assigned a community navigator, and that is a representative through the Columbus organization that provides that targeted case management on behalf of the division. Individuals that live in a provider managed setting, otherwise known as a group home or a neighborhood group home, they do have a DDDS support coordinator. And individuals that are enrolled in the Diamond State Health Plan Plus, otherwise known as the LTSS program, their primary case management comes from the Managed Care Organization, or MCO for short. But DDDS does have a family resource coordination unit to assist with very specific DDDS things. And we talk about those things later within the presentation. So the goal of the person-centered plan, again, what's your good life? And the reason why this is important is because an individual is in charge of their own life. They really are. And, you know, pardon me, sometimes it can be difficult to know what it is that we want. So sometimes it's okay to just start with what it is that we don't want. But the plan is developed with the individual and their team members with the purpose of outlining their preferences, identifying support needs, lifestyle choices, goals, any plans for their future, whatever it is that they need, how it is that they want to worship, to support their vision of how it is that they wish to live. The reason why I like to talk about this is because the person drives the plan, and then the plan drives the services. We're going to have so much time for questions at the end, but I do want to pause. If there's a question now, go. Nancy, I see your hand is raised.
Sure. I'm sorry, I didn't mean to interrupt, but the slides are not advancing. So I know you're reading notes, but we're still on the first slide.
Oh, goodness. Okay. Let me try to disconnect one more time and share from the current slide. I'm so sorry, everybody.
No problem. And Nancy, did you have a question that you wanted to ask?
Let me unmute her. There we go.
You might have to unmute yourself, Nancy.
I was just going to point out, as you did, that the slides are not advancing.
Great. Yeah, I didn't want to interrupt because you were on a flow, Jennifer, but I was
trying to get a flow, but it's okay. We'll get there together.
No problem.
I'm just closing everything out. I'm going to start fresh.
And we will be sharing Jennifer's slide deck with all of the supporting materials in a follow-up email. So you guys will get the actual slide deck. So that'll be helpful as well.
Can everyone see my slides?
Yeah, we can see the slides and you might want to advance.
Yeah. Are they advancing now?
Yeah, there we go.
Okay, so here's the list of everything that we do. I reviewed the eligibility criteria, and I'm just going to go ahead and jump forward. We were talking about the person-centered plan, and the most important thing that I want to stress when talking about a plan is that individuals, they are the center. They are the why that we do what it is that we do. And the person drives their plan, and the plan then drives the services. So. And self-advocacy. DDDS supports a person's right to self-advocacy and having a voice in decision-making across all areas of their life and their life domains. And so now we're going to get into the supports and services. So the first program we're going to share some information about is called the Pathways to Employment program. And Pathways came to Delaware in 2015. It was approved by CMS, which stands for the Center of Medicare Services, the federal level. And it is a state plan program authorized under the 1915C Home and Community-Based State Plan option. It is funded partly with Medicaid funds, and it's similar to our waiver, but some different rules apply. Pathways is a collaborative process. We have very strong partnerships with the state's Division of Vocational Rehabilitation. They're all about work, and they're a part of the Department of Labor. Of course, DDDS, and then our Department of Education, which is actually where a lot of our referrals do come from for not only our program, but for our services in general. Pathways eligibility, we can start supporting students, young individuals with disabilities as early as the age of 14. They do have to be enrolled in Medicaid. The financial criteria for the Pathways program is 150% of the federal poverty level, which means, generally speaking, the individual cannot be earning more than that in order to qualify. They have to want to work. That's the most important criteria, is that they have employment goals. And they do have to meet the target or functional criteria that would be related to not just an intellectual or developmental disability, but a visual impairment or a physical or orthopedic disability as well. So there's 3 different target disability groups that can access these services. Another thing that's important to note about Pathways to Employment eligibility is that the medical criteria is not as stringent as that of DDDS. So if an individual does not qualify for DDDS services, they may still benefit or be eligible for services through the Pathways to Employment program, which would be an appropriate way to have access to case management, to have some support and services that might benefit the individual to help meet their career goals, including obtaining and maintaining and advancing in competitive employment. And the services within that program that help facilitate that are employment navigation. That's the targeted case management. All they do is focus on your plan for employment, help identify next steps in order to be successful, and connect you to resources that will help you meet your goals. Career exploration and assessment is a service for individuals that, maybe they don't know what they want to do, and they need a little time to figure it out. Or maybe it is they know exactly what it is they want to do, but they want to be able to build a little bit of experience and identify what accommodations they might need in the workplace. Variety of different reasons on why they would want to explore, but that is one of the services available within the program. Supported employment for both group and individual. This would be the service that funds like job coaching if someone needs a little bit of help in the workplace in order to be able to be successful. The program also offers benefits counseling, financial coaching, non-medical transportation, personal care attendant services, and then orientation and mobility and assistive technology. It is important to remember that the services that are delivered through these programs, are delivered by the authorized provider network. DDDS does not provide the services. We operate the waivers that fund the services, and the authorized provider network that delivers the services. And so now we're going to talk about the Medicaid Home and Community-Based Services 1915C Lifespan Waiver. Typical enrollment for Lifespan Waiver would happen at the age of 18 or in their final year of secondary school. So that final year of IDEA eligibility is typically when we start enrolling individuals that want to access services through the waiver. And a lot of people immediately they hear the word waiver and they think, what am I giving up? But that's not what that means in this case. In relationship to Medicaid and the lifespan waiver, waiver means that the regular rules of Medicaid are waived or not applied. And that allows for these services, which were historically only able to be delivered in an institutional setting, to be able to be delivered in the community. And again, it's important to remember that waivers are a funding source for those who qualify to access services and supports that they may need in their home and community. Why is it important? Why have a Medicaid waiver? Well, again, it's a funding source for services that support life goals and enhance life outcomes. Medicaid matching does help Delaware to support sustainable service systems. And the lifespan waiver is designed with services to support individuals as they age across their lifespan. We consider it a comprehensive waiver. So states have the ability to design Medicaid or waiver programs as they see fit. One of the things that's unique about Delaware is we don't have a wait list for our waivered services currently, which is not the case in many of our other neighboring states, even across the nation. So we don't currently have a wait list for our services in Delaware. Providers may deal with capacity issues from time to time. And so individuals always have the ability to choose based on available providers, and they can make switches, but there is no wait list for services, and that's fairly unique to our state. Lifespan waiver eligibility. So in order to be eligible for services through the lifespan waiver, an individual must first have been determined eligible for DDDS services. They have to meet the level of care, and there is financial criteria associated with the lifespan waiver. If you or your loved one has been determined eligible for DDDS services, they're likely going to meet the level of care. So don't allow that to be another thing that you think you have to do. But some of the services on the lifespan waiver do have limits and a separate set of criteria in order to access. In regards to the financial criteria, there's two types of financial criteria for the lifespan waiver. There's the financial or the income test, and then resource. So in most cases, an individual can earn no more than 250% of the Social Security income federal poverty level, which in 2021 was approximately $1,900 a month. I haven't crunched the numbers for 2022 yet. And then the resources, which is pretty standard for most Medicaid programs, an individual can have no more than $2,000 in resources. That's the financial eligibility criteria for the lifespan waiver. And remember, if you've already met the eligibility criteria for DDDS, then we know that you meet the medical criteria for the lifespan waiver. So in the previous slide, we talked about how in most cases, and this is the reason why it's in most cases, because there's another program called Medicaid for Workers with Disabilities that allows individuals with disabilities to earn up to 275% of the federal poverty level. This is not our program, so this is all the information that I can present about it, but it is important for individuals to know that if they qualify for the Medicaid for Workers with Disabilities program and have that higher earning potential, and they meet this requirement, they still meet the requirements for the lifespan waiver, even with the increased income. Okay. Everybody's financial situation is different. And so if you or your loved one finds themselves in a position where they need to become financially eligible for the lifespan waiver, there are mechanisms that can assist an individual to become financially eligible for Medicaid. It is important to know that neither, regardless of who your case management entity would be, whether it be a community navigator, an employment navigator, or a family resource coordinator, they cannot offer you financial advice on what mechanism would be best for you. Everybody's financial situation is different, but what we can do is assist you with identifying someone that can assist with the appropriate mechanism. That could include an elder lawyer or somebody that is well-versed and an expert in financial planning or medical planning, Medicaid planning. And sometimes we've had great success in just connecting individuals with other families and what worked for them, you know. So there's a variety of different ways to get that information. Okay, so a lot of people ask, what if a person is over the allowable income? So if a person has an income greater than what Medicaid allows, but does not have the income to pay for the cost of whatever service they're trying to achieve, they may benefit from a qualified income trust, which is also known as a Miller Trust. Miller Trusts are one mechanism that allow individuals to receive Medicaid benefits for long-term care services if their income is above what the Medicaid eligibility limit is. There are rules. Again, we cannot assist with that. An elder lawyer would be the appropriate resource if this is your case and you wanted to establish a Miller Trust. And a Miller Trust can only be used for income. It cannot be used for resources. It would only be for the amount of money coming in each month. Now, if a person is over resourced, there are a couple other mechanisms that families can consider in order to become financially eligible for the lifespan waiver. So again, the resources would be any asset or monetary account in excess of $2,000. So even 2001, you know, for $1 over, not a big deal. We go to the Happy Meal and we're good to go. But if we're talking about considerable resources, there should be some consideration in how that money is used. And in many cases, there could be rules that apply. So in order to become financially eligible, though, an irrevocable trust can be established for any resource over $2,000. And most families and individuals are familiar with the term trust, but it is created when property, so real estate, finances, other tangible items, is managed by a person, the trustee, for the benefit of another person, also known as the beneficiary. Irrevocable trusts, very similar to the Miller Trust, can be legal arrangements, and they may not be suitable for every situation. And there's specific steps to creating irrevocable trusts, and they can vary. Because of the legal nature of these arrangements, an attorney, such as an elder law attorney, should be consulted before proceeding. Examples, though, of these options in Delaware would include a special needs trust. It's generally used for considerable assets. It does cost several $1,000s often to establish a trust, a special needs trust. The pool trust, or the Delaware Care Plan. A burial trust. You know, these are tough conversations that we have to have with our individuals to have continuity of care and dignity across our entire lifespan. But a burial trust is something that could be considered if an individual or family is finding themselves in excess of resource and needing to become financially eligible for Medicaid. And the Delaware ABLE plan is actually not a trust. It's more similar to a 529A plan. But it is a mechanism that allows individuals with disabilities to save, and they just raise the limit on how much can be saved annually and for a lifetime before it would impact benefits. And they're fairly easy to establish. And the minimum money required to start an account, I believe, is only $25. Now we're going to talk about the lifespan waiver services. So again, comprehensive waiver. You don't have to make separate applications. The idea is that these services support individuals as they need them and as they age across their lifespan and across a variety of settings. And those services include behavioral consultation, nursing consultation. These are just consult services. Community transition, that's a service to help individuals move from a stricter environment to a least strict environment. So moving from perhaps an institutional setting to a neighborhood home or their own home. Home or vehicle adaptations, specialized medical equipment and supplies not otherwise covered by Medicaid. Residential habilitation services, so these are the group homes. There is a separate risk criteria in order to meet the need. You have to demonstrate a need for the residential habilitation services. Again, all of these services are designed to help people live within their community and in their own home. Supported living is a service for, I guess people would kind of call it like a drop-in service, but supported living is a service for individuals that have their own home or their own apartment. They have a lease, a renter's agreement, is their property, their place, and they just need a little bit of help in the house from time to time. So that would be the supported living service. Dehabilitation services, dehabilitation community participation, which acts as like a one-to-one day program. It's not meant to be Monday through Friday like some of the other day hab services are. It's very individualized and neat to support an individual within the community. So I like to use an example. If I'm a knitter and I want to go to the Bear Library, on every other Thursday to knit with some new friends, but I need some support in order to navigate or socialize or communicate within that environment. Community participation might be something that I could utilize to have that support I need to go meet my friends and knit. So pre-vocational services are services designed to help individuals get ready for work. Supported employment services for both individual and group are services for individuals to obtain and maintain competitive employment and also career advancement. Personal care services and respite services, and assistive technology not otherwise covered by Medicaid. So those are the services that are available through the lifespan waiver, which DDDS operates. There is another program within the state called the Diamond State Health Plan Plus. Many families know it as the LTSS program. And they ask, can I enroll in the lifespan waiver? And the answer, unfortunately, is no. Individuals cannot be duly enrolled in the LTSS program and the lifespan waiver. They would have to choose between which program best meets their needs. Some services are available under both, but not all. And again, the primary targeted case management entity for individuals within that program would be from their managed care organization. So in Delaware, that's Highmark. Thank you, Highmark, or AmeriHealth Caritas. And again, DDDS has a family resource coordination unit to help with those very specific DDDS things like choosing an agency or sending a referral. So if you find yourself in this group supported by the Diamond State Health Plan Plus, what you can expect from that program from us would be, again, assistance with identifying day programs. We do, for individuals that meet the risk criteria, assist with that residential placement to help make a good match. Our resource coordinators can attend IEP meetings, and they can make referrals to the Pathways to Employment program. So in Newcastle County, so our unit is statewide, and this lists some of the contacts, and their contact information is on another slide, but we have family resource coordinators. We have an assistant family resource coordinator. It is important to know that family resource coordinators are not case managers. We don't have regular contact, but we do assist with the very specific DDDS things during those milestones, and we are accessible to meet the needs of individuals, but it wouldn't be that targeted case management that you should be getting from the Columbus organization, a DDDS support coordinator, or your managed care organization. They submit referrals to programs and assist with the completion of the lifespan waiver, because you can switch programs. If I'm on the Diamond State Health Plan Plus, but now I think that the lifespan waiver better meets my needs, you can switch programs, and the Family Resource Coordination Unit can help you do that. And they can also assist with navigating and advocating within your MCO. So these are the contacts for our Family Resource Coordination Unit, and including my own. I'll leave it there just a minute in case you want to jot that down. But again, I did provide these slides to both Cassandra and Cheryl so that they can be shared after the presentation if you have any additional questions. And for more information about DDDS and the authorized service providers, the providers that deliver the services, please visit our webpage. And that address is right here. Now we have time for some questions. Oh, before I go and exit out of my presentation so that I can see all of your lovely faces, DDDS does have a social media page. So that's a good place if you're on Facebook to check in. We share resources, information, sometimes feel good stories, and all the happenings that we think parents might be interested about or individuals might be interested about across the state. So that being said, I want to stop share.
Awesome. Awesome.
Okay.
Thank you so much, Jennifer.
Yes.
That was a lot of information in a short time, I know. So I did want to give everybody an opportunity. If you just want to unmute yourself and ask Jennifer a question, we're happy to entertain any questions at this point.
It is a lot of information. And so it's very, very common. Most of my questions and follow-up come like the next day or even the next month or the following month, because sometimes it can take individuals and families that long to consume or to, kind of process everything that's been going on, especially when you're caring for an individual with a disability. Something comes up every single day sometimes. So we are here, we are accessible. So please don't hesitate to reach out in the future as well. What we know about national statistics is that only 1 in 4 individuals and families are aware of their disability services networks within their state. That's 1 in 4. So that is a very high statistic. Lots of folks that just don't even know that there could be a resource that could help them. So.
Now, as you are thinking of any questions you might want to ask Jennifer live, Jennifer and I met and came up with kind of 2 questions that we wanted to throw out to you guys to get you thinking a little bit. So from your perspective, as a person who would access services, what are your most common barriers? Where does your frustration level kind of get a little elevated when you're trying to access services as it relates to what Jennifer was just talking about? If you're comfortable sharing that. The other thing we would be very interested in knowing is if you had a magic wand and you could wave it and poof, it appears. What services would you create? So, that's always nice for, I think, Jennifer to take back to the drawing table and kind of take back to her brainstorming sessions is if you could pick a service, what would it be? So you can feel free to type in the chat, unmute yourself and share however you're comfortable.
Yeah.
Go ahead.
I'd like to make some comments.
Go ahead, Nancy.
Thank you. First of all, this has been very informative as a parent. And prior to moving down, Dale has been a client of DDDS since 1994. I have been an involved parent. I do not hold guardian opportunity to go through this seminar and know that I'm going to have a hard copy that will be sent to me that I can use as a reference is really encouraging. Because I'm not Dale's guardian, because of some situations that have been arising with Dale, I now better understand that all I can be is a concerned parent, but I cannot really speak on Dale's behalf. Dale is the one who drives, as you said in your seminar, his life and his goals. However, he is traumatically brain injured at birth. And but this clarifies for me, as if you will, the boundaries that I must work within in advocating for Dale. And I'm encouraged that Jennifer also has provided to us contact names and phone numbers and emails, so that moving forward, if need be, I can reach out and say, hey, I think if someone could, stop in and see Dale and maybe help him make sure he understands what are his benefits, what are the resources as he's now aging. He functions at about a maturity level of 10, and cognitively speaking, functions at about first grade, first 6 months of going into first grade. He does live independently. We worked very hard at that as he was growing up, but my concerns are that as he's aging, I see because of the severity of the brain injury, I see extreme stress. And I don't think he's able to make good choices, but I realize I cannot, my boundaries are set. And so I have to have confidence and faith in the community navigator that works with Dale. But again, it's been a valuable seminar up to me talking now. This helps me tremendously.
Awesome. Thanks for sharing, Nancy.
Yes, thank you for sharing, Nancy. And I would like to share one other thing. One, congratulations. You know, Dale, 56 years of what sounds like a wonderful life experience. You know, there's certain things that we get that you just can't teach from experience. And so I hope to be able to meet him someday in person. The end of 2020, DDDS answered the call to what I'll call them our parent champions or parent ambassadors. But I think everyone remembers March 2020, just kind of like, whoosh. Took the wind out of our sails, and here we are still trying to kind of get by on most days, right? That being said, there's nothing better than joining together for solidarity sometimes. And so we were approached by some parents, and then it's like, hey, what do you think about getting together? And we say, we think that's great. How can we support you? And so that event turned into what they call the Fireside Chat Series. It is a monthly virtual meetup. So Nancy, I forget where you said you were, but North Carolina?
I'm now in North Carolina, but to
Yeah.
learn that it's virtual is encouraging.
Exactly. You can, and it's, you know, we want to be able to have conversations statewide. You know, the needs of our families vary neighbor to neighbor, but the resources vary county to county, you know, so getting parents together, there's a lot of value in sharing, even if it's just for comfort. And so I will make sure that both Cheryl and Cassandra have that information. I welcome you to email me, but it's going to be starting up this month. There's a variety of topics that they parent vetted, parent led. We just lend the time and technology because of the Zoom account access. So, but that was
so.
good
Are you
opportunity.
able to provide me with a date and a time at this point?
Yes, it's the last Thursday of every month. So for this month, I think that's the 27th. I'd have to check a calendar, but 6:30 to 8, the last Thursday of every month from 6:30 to 8. And we'll make sure that you get that information.
Yeah,
Nancy.
I appreciate it. Thank you very
We'll
much.
include that flyer for everyone and even anybody that registered for this conference that wasn't able to join live, they'll also get the materials. So yeah, we'll give you that flyer, Nancy.
Thank you.
Yeah, and Nancy, you brought up another topic that parents, you're not alone, dapple with, and you know, and it's the ability to help make decisions, right?
Yes.
And so there's a variety of different mechanisms, guardianship being one, which is, you know, some parents and individuals and families, that is what they decide to do, and it best meets their needs. But there are all alternatives to guardianship. But to your point, and why it's so important to have a plan that we think about what it is that we're going to need. What Dale needs at 56 is going to look different than what he needs at 70, right?
Yes.
So starting to have those conversations now about what that looks like, from where it is that you'll live, at what point, if he's lived this long independently, can he identify, okay, once it gets to this point, I'm going to need some additional support. And this is where I get that. You know, we don't have to, we can just start thinking ahead about what those things are and include him in that process so that his, you know, his wishes are honored. But it's a necessary thing. You know, we get older each day, and our needs change each day. So having those conversations. But to your point, with the guardianship, which I wanted to add in case there's any other parents that are considering that, there used to be a time, and it might still exist, I'm not sure, but if I had a disability or I had a son or a daughter with a disability, boom, you have to have guardianship. Like I said, in some cases it is appropriate, but there's a variety of different ways that parents, individuals, loved ones, somebody selected by the individual as a trusted person, that they can enlist to help make those decisions with them. Something as simple as a supportive decision-making agreement, which is a viable and legal arrangement here in Delaware, to power of attorney, advanced healthcare directive, you know, those types of things. But really even just that relationship, if Dale says, Mom, what should I do? You know, providing that guidance is a good thing. But something that's come up a lot that I'll share with individuals is the Delaware surrogacy law. And that is a piece of Delaware code that allows individuals without guardianship who might at the time lack capacity to make decisions for their own care, a parent, guardian, sister, there's a whole list of next of kin that would be the next legal representative to provide that consent. And I offer that information because many individuals do struggle with, should I do it? Should I not do it? I want them to be independent, but what if? So that is a good example of a Delaware code that already exists that can help address the what ifs in a medical care setting. Should the adult child require consent and is unable to provide it? So hopefully that can give you a little peace of mind.
I don't want to, what's the word? I don't want to be the only person sharing and asking questions. And I think at this point, maybe it would be appropriate for me to have a one-off with you, whether it be via email or something like that.
Oh, yeah.
But everything that you're offering now, Jennifer, is shedding light that I didn't know about as a parent,
Well,
as
I'm
to
glad I've
options
been
and
here.
choices.
Yeah.
Excellent. So excited. So do we have any other questions? Or any other thoughts about that magic wand, what that might look like? And then maybe some, some common barriers, or the most common barrier you've encountered when trying to access services. And hearing none, I will give you still some opportunity to type it in the chat. If you're shy and you'd rather type, we're totally happy to do that. But as we kind of wrap up, I did want to again thank you, Jennifer. This was really, truly very informative, very easy to follow. You really put it in terms that I think really for the listener was like, oh, okay, that makes sense, right, guys?
Yes.
It wasn't like sometimes people are speaking to you and you're not even kind of getting what what they're trying to say. So we appreciate you spending time with us today, Jennifer. The information was extremely important and very helpful, and I think it will help our brain injury community greatly. So thank you.
Yes,
As a follow-up from today's webinar, as I said, guys, all the participants and anyone that registered will receive a nice follow-up email with a copy of our upcoming webinar series. So we do this every third Tuesday of every month. So you'll get a nice schedule. We have lots of really interesting topics. We do it once a month. So we have 11 more. So you can kind of pick and choose where you want to plug in. And as well, if you register and you can't join us live that day, you can always access the recording. There are 3 examples that we can't record because we've entered into a partnership with the American Red Cross. So they're going to actually do 3 caregiver seminars. So that'll be 90 minutes versus 60. That's a closed session. We will not be recording because we'll be sharing, some personal things. We'd invite you to join us live for that because it really will be helpful. They have a whole gamut of webinars that they offer to their caregivers. So I'm excited to participate in that one. So we'll give you that schedule. We'll also give you a short survey to allow the participants today to provide feedback to us so we can always make our webinars better. We'll give you an actual link to the recording. So if there's something that you wanted to go back to and listen to again, you certainly can. A copy of the PowerPoint. And then Jennifer's already sent us like 5 supporting materials. And I think you promised one more. We do have a question. Can you go over the allowed income
Sure, I see the question.
Yeah, okay, there you go.
So the allowable income for the lifespan waiver is 250% of the federal poverty level. So as of last year, that was about $1,900 a month, and that would be both earned and unearned income. So essentially, if an individual was earning more or had more income in a month that exceeded that 250, so well over $1,900 a month, they would need to become financially eligible in order to meet the criteria, which could include a mechanism such as a Miller Trust. The resource is the other piece of the financial eligibility criteria, which is the standard $2,000 which Medicaid sets. And so, yes, that does include savings. So it would be any community account. I know that there are specific rules when you are becoming eligible for Medicaid. And that is why we refer individuals to an expert to make sure, words like shelter are not allowed, but you are able to move resources into the appropriate mechanism in order to meet that financial eligibility criteria for the resource and both income. So if our individuals are considering significant assets, a special needs trust would be appropriate, when we have multiple pieces of property. We've done our due diligence and savings, or we're very blessed financially, a special needs trust might be the right mechanism. They're very costly and expensive. But if we're just talking about a little bit of money over, an ABLE trust, and actually anyone with, an individual that is working on learning financial literacy, if you have any teenagers or young adults, ABLE accounts are really flexible. And they can be used for a variety of different expenses, not just, very specific, like up to and including things that enhance life's outcomes. So things like, a trip or something special that you wanted to save for. ABLE accounts are very, very flexible. So hopefully, did I answer your question, Kathy?
Yes, she said,
Yeah.
thank you. Yeah.
You're welcome.
Perfect. So one last thing, I would encourage you, once you get this email, to share the link, share the information with your friends and family and colleagues. This is not something that's proprietary. It's not like just because you were here today, you're the only one that gets to learn this. Feel free to share. We'll be sharing a lot of these links on our website. And always, we'd like to remind you to visit the Brain Injury Association of Delaware's website for more information about support groups, about resources. We have a helpful links section. We have a resource directory. So you will see much, much more coming from Jennifer. We have a nice little partnership going, right, Jennifer?
I'm excited.
And I would like to invite you to join us next month, which would be February 15th at 2:30 for our February Educate Delaware 2022 webinar. Our guest presenter will be a representative from the post-acute medical health organization known as PAM. They will be discussing services and community resources for brain injury patients. So please mark your calendars, invite people to join with you. The more the merrier. And Michael had a question. Can I access this recording later to review materials? Absolutely, Michael. You can, once we send you the link, you can click on the link. You can rewatch it, watch it and rewatch it as many times as you'd like. The hard copy materials will come with it. And again, feel free to share it. There's nothing protected. It's all public information, right, Jennifer?
Correct.
So thank you guys so much. Thank you again, Jennifer. This has been very informative. I'm going to have to go back and watch again because there is a lot of information, but it was very good.
There's a lot. And so please don't hesitate to reach out. My contact information is not private either. So I welcome emails, phone calls. We're just here to help. So
thank you.
Thank you, everyone.
Bye.
Bye-bye.
Bye, everybody.
Bye.